Good morning, everyone. So, today we are going to continue with our discussion about the different um, chemotherapeutic agents. So, we're done with the antibacterials or antibiotics. Now, we are going to talk about antivirals, antifungals, antiprotozoals, and anthelmintics. So, we start with the antiviral agents. Influenza, this is one of the most common diseases that there is in the world. It's also known as the flu, and this is highly contagious since it's a viral infection that affects mostly the nose, the throat, and the lungs. So it's affecting the whole respiratory system. So it is easily transmitted via contaminated droplets during coughing, sneezing, or even talking. And there are three types of antigen for influenza. We have type A. This causes a moderate to severe infection. Type B, wherein it usually causes mild illness in children. And type C, which is very rare in humans. Usually for the flu, we really do not give patients antivirals since this type of infection is self-limiting, like the other type of viral infections, such as measles, chickenpox, rubella, and so on. When we say self-limiting, it means that the body's immune system is going to fight it off without any medications or help at all. With these kind of infection, the role of us nurses is to give supportive treatment or palliative treatment. When we say supportive or palliative, this means we are just controlling the signs and symptoms of the disease, such as fever, such as the cough, such as the colds, in order for the patient to feel at ease. But for viral types of infection, the common ones, such as this one, flu, usually we really do not give medications unless it is necessary or unless the patient's condition has worsened. We also have herpes viruses. When we talk about these kinds of viruses, herpes, it doesn't only pertain to the sexually transmitted infection. There are various forms of these viruses. And what are they? There are different types. You have the herpes simplex virus type 1, the HSV type 1, which causes cold sores. So sometimes we experience these things. We also have herpes simplex virus type 2, HSV type 2, which this is the one that causes genital herpes. This is the sexually transmitted infection. So that is one of the viral infections that can cause STD or STIs. Number 3 is varicella zoster virus, or the HSV type 3, or the VZV. This is the one that causes chickenpox or its sequelae. Remember, if you have been infected with chickenpox, that doesn't mean that you are already immune to it. No. If you are, or if your immune system currently is suppressed and you are again exposed to the virus of chickenpox, so you already had chickenpox before, but later on, due to untoward circumstances, your immune system is somehow suppressed. That happened to me. I had chickenpox when I was around first year in college. Then there was one time wherein I working long hours into the night shift. So I was several days or weeks even doing the night shift. Somehow my immune system went down. And I'm not sure where I got it from. I was again exposed to the varicella zoster virus. The sequelae of chickenpox appeared again in the form of shingles. This is different from chickenpox because shingles, the lesions of shingles, if you can recall, the lesions of chickenpox, they are they can, or you can have these water-filled pustules or water-filled lesions all over your body, known as vesicles. So if these vesicles are found all over the body, then that would be chickenpox. But for the sequelae, which is shingles, it can be localized. So you can only find these vesicles at a certain area of the body. In my experience, the vesicles appeared on my right upper quadrant of the abdomen. And unlike that of chickenpox, which can be itchy, the vesicles for shingles is somehow different because it's painful. Even with the touch of the fabric of my shirt can cause intense pain over those lesions. So that's the varicella zoster virus. Number 4, the Epstein-Barr virus or the HSV type 4 or the EBV. This causes mononucleosis, or what we call in short as mono. Mono is also known as the Tay-Sachs disease because this can be transmitted through kissing or through, for example, if you know someone or if a family member is having this disease and you shared utensils, for example, such as a glass or a spoon or fork, you can transmit this by sharing these utensils. And lastly, cytomegalovirus or the HHV type 5 or the CMV. This is the last virus in this family of herpes viruses. So a cold sore can look like this. It usually appears on the lip. For genital herpes, as you can see here, the vesicles are found in the genitalia. And with this, it's localized as well. You can only find the vesicles, the lesions in that area, the genitalia. So it's similar to chickenpox, but it's localized at the genitalia. Now we go to hepatitis B or the HBV. It's a serious liver infection that is caused by the hepatitis B virus. And the transmission of this is similar to the transmission of HIV or human immunodeficiency virus. It's usually through needle stick, intimate sexual contact, or even in childbirth. Or if the nurse accidentally blood transfused a blood product that is infected with this virus. Now, we have the following medications or antivirals that are non-classified. The first one, amantadine hydrochloride, this is used as a prophylaxis against influenza A. So if you've been exposed to people with influenza A, you can be given with this in order for you not to be infected. Cidofovir or Vestide, this for patients who are experiencing the CMV infection of the retinitis, especially for patients who are suffering with AIDS, because CMV can occur with AIDS. Remember, in AIDS, the body's immune system is very, very suppressed due to the virus. So other opportunistic infection can occur. Foscarnet or Foscavir, these are the ones that is being used to treat herpes viruses, various forms like type 1, type 2, even the one for chickenpox, also for CMV retinitis. So Foscarnet, this is the one that was prescribed to me when I had shingles before. That was 9 years ago. Rimantadine hydrochloride, Flumadin. This again used as a prophylaxis in the treatment of influenza A. So if you have the flu. Telbivudine or Tizica, it's for chronic hepatitis B virus infection. Same with Adefovir, Dipivoxil or Hepzera, and Entecavir or Baraclude. These are used to treat hepatitis B virus. So remember this mnemonic for hepatitis B virus medications, TAE. Remember that. Since TAE is coming out of the GI and the liver is part of the GI, so that is our mnemonic for these three common medications for the hepatitis B virus, the bivudine, adefovir, and entecavir. Now we go to the Neuraminidase Inhibitors. We have oseltamivir phosphate, or the Tamiflu. This is used for the treatment of acute influenza type A and B. And take note, with oseltamivir, this should begin within the 48 hours of flu symptoms. So once the flu symptoms have appeared, this medication should be given immediately so that the flu won't worsen. Zanamivir or Relenza, this is for, again, influenza type A and B and the H1N1 influenza. If you recall the previous pandemic, it was short-lived. In 2009, the H1N1 influenza, this drug was used for that. Now for the COVID-19, there are certain virals that are still being studied, but it's not yet approved by any Food and Drug Association of other countries, even here, or the agencies, Food and Drug agencies of other countries and here. They're still studying it. Next, topical non-HIV antivirals. Penciclovir or Danavir, it's for recurrent herpes labialis. Herpes labialis class is also the same, or the virus for herpes labialis is also the same virus that is causing herpes genitalis, the STD. So for example, a person has done oral sex on a person who has herpes genitalis, that herpes infection can occur on the person's lips. So in order to treat that, this can be given. And take note, herpes simplex or herpes simplex type 2, HSV type 2, it's the same as that of chickenpox. You can have it and it will soon disappear, same as chickenpox, but it can reappear if your immune system is down. So both the virus for chickenpox and herpes genitalis, the STD, can be dormant in our body. It's in our body, but once our immune system is down, they can recur. They can appear once more. That's how herpes labial or herpes genitalis and labiasis can be transmitted. Trifluridine or Viroptic, this is for keratoconjunctivitis due to herpes simplex virus. That is why if the mother who is giving birth has herpes genitalis, this should be applied to the eyes of the newborn as a prophylactic treatment for keratoconjunctivitis. Purine nucleosides. We have acyclovir or Zovirax. This can be used to various herpes simplex infections. They can be used to treat shingles as well. Famciclovir or Famvir for herpes zoster and HSV1. Varicella zoster immune globulin. This is used as a post-exposure prophylaxis of varicella zoster. So if you've been exposed to a person who has chickenpox, you can be given this in order for you to be safe from chickenpox. Ganciclovir sodium is used to treat CMV. Ribavirin, Virusolol, it's used to treat respiratory syncytial virus infection. Usually, this type of viral infections are occurring in patients who have AIDS. Valacyclovir hydrochloride, Valtrex, again, used to treat shingles. Also, genital herpes. Valganciclovir or Valsite, it's used to treat for CMV infected cells of retinitis in AIDS. Now we talk about HIV or AIDS. As we all well know, HIV, just to give you a background with regards to HIV and AIDS, this is transmitted sexually, and the most dangerous type of sex for the transmission of HIV would be anal sex. Remember, in anal sex, there's no lubrication there. So there would be micro tears in the anus of a person engaging in that form of sex. These micro tears, skin tears, will be the portal of entry of the virus from the semen, from the infected semen. So if the semen is infected with HIV, it will enter those micro tears, micro wounds on the anus. That's why anal sex is very dangerous for HIV. Other than that, through sharing of needles, if you're a drug addict, or through childbirth as well. And HIV will remain, or if you are infected with HIV, you will be asymptomatic for a very, very long time. And if you experience signs and symptoms of having HIV, then you are already proceeding to its worst form, which is AIDS. Because usually the virus will stay in your body without producing any signs and symptoms. It will continuously replicate until eventually it is going to destroy the person's immune system. That's why for AIDS, it's known as acquired immunodeficiency syndrome, because the immune system is deficient. It is down, it is suppressed by the virus. And once you present signs and symptoms of this, you're already in that stage of having AIDS. And in order, if you have been detected to be positive for HIV, in order to control the replication of the virus, you will be given these agents for HIV. We have the reverse transcriptase inhibitors. They prevent the transfer of information that would allow the virus to replicate and survive. So it will prevent the reproduction of the virus. For the protease inhibitors, it will block this enzyme, protease, which is essential for the maturity of the virus and activity within the HIV as well. We also have nucleosides, which interferes with the HIV replication by inhibiting the protein synthesis, leading to viral death. So these agents, these drugs for HIV will help prevent the multiplication or the reproduction of the virus. Therefore, once given to these patients who are HIV positive, they won't be proceeding to AIDS. That's why there are certain people who are HIV positive, and if they are taking these agents, they can live a normal life. Their lifespan would be the same as that of people who are negative from this virus. Take Magic Johnson, for example. He has been diagnosed for HIV. He's HIV positive. During the early 90s, he was still a basketball star of the LA Lakers during that time. And he still didn't retire after being diagnosed with HIV. Until now, he is still alive because of these antivirals for HIV. So they can live a normal life if they are taking these agents against HIV. And what are they? We have reverse transcriptase inhibitors. Remember, HIV positive patients need this. They need this daily. They need to take it daily. Remember, need, N-E-E-D. Nevirapine, Viramune, Efavirenz, Sustiva, emtricitabine or Emchiva, and delaverdin prescriptor. Remember, need. Next, we have the protease inhibitors. We can give Amprenavir, Agenerase, Atazanavir, Reataz, and Fosamprenavir, Lexiva, and Indianavir, Pixivan. So these are the protease inhibitors. And we have the nucleosides, didanosine, Videx, lamivudine, Epivir, stavudine, Zerit, and sidovudine, Aztec, or Retravir. So these are the different drugs used to treat HIV. Now we go to drugs that is being used to treat hepatitis B. Adefovir and entecavir. I've mentioned them earlier. If you can recall, the mnemonic TAE, they inhibit reverse transcriptase, which is needed in the replication of the virus, the Hep B virus, which will cause now the DNA chain termination. Once the DNA chain or the copying of the DNA code is terminated by this, the reproduction of the virus will stop. So that's it for the antiviral agents. Now we go to the antifungal agents. Fungal infections. These are infections caused by a fungus or fungi, and we term this as mycosis. When you have a mycosis, that means you have a fungal infection. It can be superficial, so on the skin, or it can be systemic. But systemic fungal infection rarely occurs. The more common one would be superficial, especially the fungal infections of the skin. So superficial infections are or can occur also in the mucous membranes, the hair, the nails, and of course the moist skin areas. What are the moist skin areas? You have our armpits, our groin area. So there can be an overgrowth of non-susceptible microorganisms in the normal flora following antibiotic treatment, which can also cause a superficial infection. Now, we go to this continuation of what fungal infections are all about. Candida albicans affecting the mouth is known as oral candidiasis or thrush, oral thrush. It's one of the most common fungal infections that we have. Vaginal candidiasis are also common in women, especially those who are pregnant, diabetic, or taking antibiotics or viral contraceptives. Remember, the pH level of the vagina is preventing the Candida albicans, which is commonly found on our body. It's preventing the growth of this fungi on the body. But if the pH level of the vagina is not maintained because somehow they're pregnant, diabetic, or because of antibiotics or contraceptives, if the pH level changes, if it increases, the fungal or the fungi, Candida albicans, will come out, causing vaginal candidiasis, also known as yeast infection. Yeast infection is one of the most common infections that a patient can have in their body, most especially if their personal hygiene is being neglected. And it's not with regards to personal hygiene. In my case, I had this experience before when I had yeast infection of the armpits and the groin area. What happened here is I have this condition where I sweat a lot. I sweat too much. Maybe sometimes brought about by stress, sometimes brought about by the temperature. But when I do exercises, I do daily exercises, and if I didn't take a bath immediately after exercise, this type of infection will occur, yeast infection. This happened to me That was 3 years ago, I think. So right after working out at the gym, of course, I have sweat a lot. And if I didn't take a bath after working out, immediately after working out, this type of infection can occur, yeast infection. And I had that on my armpits and my groin area. It was itchy. At the same time, it was painful. Somehow the type of pain I felt there is burning pain. So I treated it with antifungals in order to get rid of it. So I remove that thought because we have that common practice here in the Philippines, wherein if you did an exercise or so, there's a saying here in the Philippines that after an exercise, after a hard work, you're not allowed to take a bath yet because you are going to have this condition known as PASMA, which is a myth. PASMA is not real. It's just a myth. So what I did is I removed that belief, that false belief, that myth from my mind, because my mother, when I was young, after doing hard work or exercising or what, she always tells me not to take a bath right after doing an exercise or whatsoever. So I had that ingrained into my mind. But later on, due to this kind of practice, I have suffered from yeast infection on those areas of my body. So now, after working out, after doing an exercise, due to my condition of hyperhidrosis, which is sweating a lot, I really need to take a bath after workouts or having an exercise, or else yeast infection can occur. Okay, going back. Systemic fungal infections may also involve the lungs, the CNS, or the abdomen. And they rarely occur. They can only occur if your immune system is suppressed. And there are two types of fungal infection. We have the opportunistic, Candidiasis, aspergillosis, cryptococcosis, mucormycosis, and the non-opportunistic ones, sporotrichosis, blastomycosis, histoplasmosis, and coccidioidomycosis. When we talk about opportunistic infections, this can only appear if your immune system is suppressed. But for non-opportunistic ones, even though your immune system is all right, they can occur. You can have these kinds of infections due to, let's say, for example, histoplasmosis. You can get this. It's a zoonotic disease. You can get this from animals. Animals such as bird or even bats. So these are the different types of fungal infections of the skin. We have the ringworm, you have the jock itch, so that's found in the groin area. You have the Tinea versicolor lesions. In Filipino, this is known as an. You have the athlete's foot. That's why it's called the athlete's foot, because athlete's foot is sweaty. If you do not wash your feet after doing an exercise or doing sports, you can have this. Oral candidiasis looks like this. The oral thrush. It's a white lesion found on the oral cavity with the tongue. Vaginal candidiasis will look like this. So it's a whitish lesion on the vaginal wall. Now we go to the systemic antifungals. The most common one is amphotericin B. It's used to treat aspergillosis, moniliasis, and candida infections. And it's only available through IV since it's poorly absorbed through the oral route. Caspofungin is used to treat aspergillosis. Flucistocin, it's used to treat candida infections. Micafungin, it's used to treat esophageal candidiasis. And nystatin, it's used to treat intestinal candidiasis. Now we go to the azoles. These azoles, they are being used to treat skin fungal infections such as ketoconazole or Nizoral. It's used to treat various forms of skin fungal infection. And do not take, if this is taken orally, do not take it with a herb echinacea because hepatotoxicity can develop. So ketoconazole and terbinafine or Lamisil, they come in creams or ointments. The one that is common here in the Philippines would be Trocid, is the brand name of ketoconazole. Canesten cream is also one of the common antivirals or antifungals here in the Philippines. And usually for antifungal infection of the skin, the application of these medications are not done for just a day or even a week. It's done for several weeks until the lesion disappears. Gentian violet, which is a generic, is an old treatment for skin fungal infections. And cotrimazole also. I think this is the brand name of cotrimazole here in the Philippines is Canesten, if I'm not mistaken. Now we go to the antiprotozoal agents. One common protozoal infection that we have here in the Philippines would be malaria. And they're caused by 4 types of species. We have the Plasmodium malariae, Plasmodium ovale, and Plasmodium vivax, and Plasmodium falciparum, which is the most severe form. And unfortunately, the common type of species for malaria here in the Philippines is Plasmodium falciparum. And take note, malarial diseases or infections are common in areas that are mountainous. So you cannot find that here in our province. Other provinces, they are common. And the vector for this disease is the Anopheles mosquito. There are 2 phases of malaria. We have the tissue phase, which is invasive body tissue, which is usually asymptomatic. The second phase is the erythrocytic phase, wherein the protozoans invade the RBCs. And once the RBCs are invaded, later on, symptoms such as chills, fever, and sweating will occur. The incubation period of malaria would be around 10 to 35 days, followed by flu-like symptoms. So this is the example of the Anopheles mosquito. Now we have the antimalarials. Quinine. For quinine, we need to watch out for ototoxicity. So tinnitus can occur since there's cranial nerve number 8 involvement, which is the vestibulocochlear nerve. Monitor the patient's kidney and cardiac functions as well. Chloroquine, same as quinine, you need to watch out for ototoxicity. We also have hydroxychloroquine. This is one of the drugs that is being used today that is somehow used to treat COVID-19, but further studies are still being done on this drug. It is a drug for malarial infection, together with mefloquine, primaquine, and pyrimethamine. Atovaquone proguanil is a combination of antimalarial drug together with artemether lumefantrine. It's also a combination. But for antimalarials, always remember the suffix quin. If you have heard of it, quin, automatically that is an anti-malarial. It can be quinine or quinine, primaquine, mefloquine, chloroquine, and so on. The only things that are given in combination would be atovaquone, proguanil, and artemether lumefantrine. Now we go to other protozoal infections. One of the most common protozoal infection that can occur to people would be amoebiasis, which is caused by Entamoeba histolytica that causes diarrhea. This is a diarrheal infection, and you can get this from drinking contaminated water. Leishmaniasis, which is a disease caused by protozoan that is passed from sandflies to humans, which causes lesions of the skin, viscera, and mucous membranes of the host. This is caused by this vector, sandfly. And it is not common here in our country. It's common in Africa. For trypanosomiasis, there are two types. We have the African sleeping sickness, which is caused by Trypanosoma brucei-gambiense, and the Chagas disease, which is caused by Trypanosoma cruzi, which can lead to severe cardiomyopathy. So these diseases are deadly. Trypanosomiasis. For the vector of African sleeping disease, the vector is the tsetsey fly, which is this one. And again, this is common in Africa. Well, for Chagas disease, it's not common here in the Philippines. It's common in South America rather, which is the vector for it is the triatomine bug. Other protozoal infections, we have trichomoniasis, which is caused by another flagellated protozoan, Trichomonas vaginalis, which is the common cause of vaginitis. Giardiasis. If here in the Philippines, the common one is amoebiasis. In the US, in North America, it's Giardiasis, Giardia lamblia. It's the most commonly diagnosed intestinal protozoan in the US. Now, if the person has AIDS, pneumocystis carinii pneumonia can cause pneumonia to the patient. It will be opportunistic once the patient has AIDS. And these different drugs for protozoal infections can be given, such as atovaquone, Mepron, metronidazole, Flagyl, which is the most common one, nitazoxanide, Alinea, pentamidine, Nebupen, tinidazole, Tindemax. And these drugs, they inhibit DNA synthesis in the susceptible protozoa. Once the synthesis for DNA is stopped, of course, the reproduction of protozoans will not occur. So the most common one would be metronidazole. If you see a patient who is suffering from amoebiasis, this will be given through IV drip. Take note, metronidazole is given via IV drip. It is piggybacked to the IV fluid of patients. So this is the most common one, Flagyl or metronidazole. Now we go to the anthelmintic agents. These are agents that are used to treat parasitic infestation of the body. Now we go to the types of parasites. First, we go to nematodes or the roundworms. Pinworms, as you can see here, they usually lay their eggs in the anus, and they lay their eggs at night. So if the person who has been infested with pinworms starts scratching their anus or the anal area at night, that's indicative of the patient having pinworms. We also have whipworms. They look like this. Threadworms, ascaris, which is the most common form of roundworm that a patient can be infested with. Hookworms. We go to the platyhelminths, flatworms, the cestodes, tapeworms, flukes or cystosomes. You will study more of this in microbiology. We'll focus more on the drugs here, microbiology and parasitology, because these are parasites. We have mebendazole, which is the most common here in the Philippines for mumps. Pyrantel, antimint, thiabendazole, mintazole, albendazole, albenza, and praziquantel, biltricide. This is the drug of choice for patients who are suffering from schistosomiasis. Remember, schistosomiasis is also common here in the Philippines, especially for farmers. And schistosomes usually are it's a zoonotic disease because they can come from snails. The scientific snail or scientific name of that snail that is found here in the Philippines is known as Oncomelania quadrasi, which causes the person to have schistosomiasis. And take note, you can only have schistosomiasis if you have an open wound on your lower extremities. because farmers, they wade through the rice fields which contain water and water for irrigation. And if these type of snails are found there, the Oncomelania quadrasi, they carry the cystosomes. You'll learn more about this in your community health nursing. That topic is found there. But for these drugs, mebendazole, albendazole, they're commonly given here under the Garantisadong Pambata program of the Department of Health, which is done every April and October of every year. Together, they are giving these to patients who are under 5 years of age. Aside from giving Anthelmintics to children under 5, they also give vitamin A supplements. It is mandatory for children under 5. Since children under 5, they are not yet taught to do proper hand washing. Sometimes they get food without washing their hands, and sometimes their hands can be can carry the ova for parasites, which they can take in, and parasites can grow and steal the nutrients that the child should have. So in order to purge the child, purge the child's parasites, they need to be given Anthelmintics. Side effects of Anthelmintics are the following: black hairy stools. Adverse effect are convulsions, fever with or without chills, general feeling of tiredness or weakness, or there's fatigue. Hives or welts, itching or skin rash can occur if they have an allergy. Large hive-like swelling of the face, eyelids, lips, tongue, throat, hands, legs, feet, or sex organs. Light-colored stools and nausea and vomiting can occur. But take note, if you're giving Anthelmintics, watch out. Black hairy stools can occur. This is normal. This is not indicative of bleeding. It's brought about by the drug. So like what I've mentioned earlier, advise parents to have the child undergo anthelmintic therapy or treatment every 6 months. Usually that is done in April and in October, together with vitamin A supplementation. So that is under the Garantisadong Pambata program, or the GP program under DOH. So that's it, class, with regards to those different types of chemotherapeutic agents. Again, thank you for watching this lecture on antivirals, antifungals, antiprotozoals, and Anthelmintics. If you have any questions, just hit me up on Facebook Messenger, and I would be more than glad to answer them for you. Again, thank you very much for attending today's lecture, and have a great day. Bye.